Director for American Health Options, and I'm honored to host this segment of AHL Radio. AHL Radio is aired as the agent services and training platform for America's Health Options insurance plans. And today you are really in for a treat. We have a powerful visionary and fellow agent who is reshaping the future of not only health insurance, but insurance in general in this United States today. Our very special guest is Mr. Clive Fowler. He is the CEO and managing partner of America's Health Options. I won't take up much more of his time. He really needs no introduction. Mr. Fowler, are you there, sir?
Yes, I am, Jerry. Thank you for the opportunity to be here and to be able to make this presentation. We look forward to a really insightful discussion today, and I'm hoping that whatever we present is going to really change and impact not just the quality of the advisors, but also the quality of the lives that they're affecting because of what they're going to be able to do for their clients. All right, let's jump right in. We got, as Jerry said, our national sales director, he talked about our HO plans, and we're going to talk today about your financial health plan made simple. This is a really, really unique concept, and the idea behind the whole thing is to be able to protect the client's health, their life, and their wealth in 3 easy steps. And you heard me right, 3 easy steps. It's just that simple. Now, let's talk a little bit about who's behind the product offering. First and foremost, let's get that cleared up. We are underwritten by a highly rated insurance company with over 94 years of collective industry experience. Millions of customers have been served. Billions of dollars have been paid out in claims within 7 to 10 calendar days. Now, I want to take a second here to just talk a little bit about that. The reason why we're able to pay claims that quickly is because, unlike other carriers who underwrite on the back end at the point of claim, we underwrite on the front end. So we know what business was coming in the door before it came in the door. So when a claim comes down the pike, we're able to handle that claim effectively and efficiently for the client. We sit on a multi-plan PHCS nationwide PPO network, not an HMO, but a PPO network. Our plans include concierge advocate services, and the aim was to be able to develop a platform where a client was going to be able to have 30 to 60% savings versus the average ACA plans or any comparable ACA plans that are out there today. We are also a fully compliant plan, and we'll talk a little bit about how that compliance was made available to eliminate the client's tax penalty. And even though we know that the mandate is going away, there's some unique benefits in the options that we utilize to allow that client to have the tax penalty exemption. These plans can be available for individuals, families, and groups. And the client gets to do one specific thing here. They get to choose what they need and want on an a la carte plate with their advisor. This is going to allow you to be able to take control of your financial health care future using the America's Health Option platform underwritten by Philadelphia American. Let's take a quick gander at what the plan looks like. Now, in a nutshell, this is a brief synopsis, but we was able to do all this on one page. Our plan, first of all, comes with a $5 million lifetime benefit. That's pretty strong, but it gets even better because you're able to see any doctor, anytime, anywhere, including specialists without referrals in using a PPO network. But check this out. You got no deductible on this plan. It's a true no money down experience for the client. It covers hospitalization, emergency room benefits, outpatient benefits, and with doctor's visits, and it also comes with a lump sum $50,000 benefit for critical illness, catastrophic issues. Now, though we know that's not enough money to solve a problem, it sure helps getting that $50,000 benefit based on diagnosis only. Comes with accident included in that product platform that allows the client to have a disability as a result of the accident, or up to $2,000 of monthly benefit, or equivalent to 60% of what their income would have been, not to exceed $2,000, but they can receive that for up to 24 months. Prescription drugs is available. dental plan is included inside of that. And when we talk about prescription drugs, we're talking about a full formulary prescription drug plan. We're not talking about a discount card. The dental is in there. It comes with full service telemedicine. And this gives the access to a doctor or medical staff 24 hours a day, 7 days a week, 365 days a year via video using your smartphone or telephonically if a smartphone is not available. Comes with a very unique concierge service. And this concierge service is going to allow an individual to get assistance when dealing with medical bill payments, medical services, surgery cost discount negotiations, and that's either before, during, or after the services have been performed so that the client can get any additional discounts that may be available for them. Comes with a minimum essential coverage plan. And that minimum essential coverage plan is what allows them to meet the mandate or the tax penalty code, but it also is chock full of benefits, such as 63 services for men and 67 benefits for women. So all of those annual physicals and well women visits and all that stuff, it's included in this plan. But here's a really, really unique piece right here. It comes with what we call our AHO Flex Return of Premium feature. We're going to talk a little bit more about that as we go into this, but that Return of Premium feature has a very unique catastrophic supplement inside of it that goes in conjunction with our critical illness section of our policy. So it gives a client double protection for catastrophic issues. Let's take a quick look at some of the examples of how we stack up against a major medical plan. If you notice over here, we're looking at a Blue Cross Silver plan with a family of 4, 51-year-old male, 43-year-old female, and 2 children. And on their Silver plan here, they have a family deductible of $11,000, maximum out-of-pocket expense of $13,700, with a monthly premium of $1,950. Now look at our plan. We have 0 deductible, but included in our plan is $1 million coverage for hospitalization, and that is per member. So in 4 people in the family, that's $4 million worth of benefit in that house for hospitalization. Included in that, they get their minimum essential coverage, they're getting the critical illness, they're getting accident with disability, dental, and they're getting a return of premium feature for additional catastrophic. And look how we came in. We came in at $1,277 compared to $1,950. That's a significant savings of $672 per month, or $8,000 annually for that family. That I would really think is a life-changing component where in the very next month, you're putting the horsepower at the wheel for that client. Let's take a quick look at what happens to a patient that is a major medical patient versus a fixed benefit insured patient. Let's talk about some of that cash. Here you're going to see an example of an MRI on the foot that was done at Regional Medical Imaging Center in Flint, Michigan. The cash self-pay client came in at $379, whereas the major medical insured patient, they were getting hit for $445. And this was as per Aetna. Tonsillectomy. Here we see at Banner Desert Medical Center in Mesa, Arizona, we're looking at a $2,800 cost rate to a self-pay person versus a $5,000 situation with Arizona Blue Cross. Another MRI on the knee. This was in Boulder, Colorado, at Boulder Community Hospital here. It's a $600 cost to the self-pay client and $1,100 cost to the medically insured patient. Clearly, there is an advantage to someone who uses cash versus just regular insurance on a major medical platform. And the unique benefit with America's Health Options Health Choice Select platform is that that product is based on a cash reimbursement basis, so the client has the option of assigning their benefit and having the claims filed that way, or receiving the cash and writing the check. It's no different than paying cash. It just wasn't yours. The insurance company paid for it for you. Let's take a look at some of the benefits included in here. We talked about that $5 million lifetime policy there, but let's look at this feature. For the first day confinement only, a client has the option of being able to choose a participation rate. What do I mean by that? They are now going to partner with the health insurance company and take control of their health insurance. And they're doing that by them choosing to choose a certain amount of benefit that they would receive for first day confinement only, whether that's sickness or hospitalization for injury, in lieu of them writing a check for a deductible. So instead of them writing a $5,000 check or a $2,500 check for their deductible, they chose to take a 50% participation partnership rate with the insurance company. So they would receive $1,500 for day one's worth of benefit and $3,000 thereafter if they were on a silver plan. And we're going to look at that in a second. The next thing I want you to focus on here is that each client has an option with their advisor to decide whether or not they want $100,000, $250,000, or $1 million worth of benefit annually for their hospitalization services. This is a bucket of money that's available for them. And in that bucket is that $250,000 or that $1 million. And what happens when they have a covered service that needs to be performed, the bucket decreases by the dollar amount of benefit that's available to them per day for that procedure that was taken. So it simply goes from their big bucket into a smaller bucket, which is the care provider's bucket. The next thing I want you to take a look at is how our covered illnesses work. Now, if you notice here, there's a $1,500, $3,000, and a $4,500 daily benefit that is paid every day, each day that the client is inside of the hospital. So for sickness, if they were on a bronze, silver, or gold plan, they would receive those dollar amounts each day minus their first day participation benefit. And we're going to talk about that a little bit later. You'll see how that actually works in real numbers. If they went in because of an injury, you're going to see that they would receive $3,000 or $6,000 and $6,000 respectively, whether they're on a silver plan or a gold option plan for injury benefit. That is a significant amount of money per day. I don't know about you, but if I were receiving $6,000 a day, that would help a whole lot. Let's take a quick look at what happens to that same client if they were in ICU. We pay 20 days of ICU right here. Now, let's think about this for a second, guys. If you get 20 days of ICU and you went in because of an injury at $6,000 a day, that is $135,000 worth of benefit paid to them for those 20 days worth of confinement, minus what they would have paid for day one on their participation. So how would this example work? Day one, they went in. They would have and they were on a 50% participation. They would have received $3,000 for day one. And on days 2 through 20, for the next 19 days, they would have received $6,000 a day. But they never wrote a check out of their pocket. They simply used the insurance money and deferred or denied themselves what we call deferred expectation. They decided not to take that full $6,000 day one, and rather than write a check out of their own pocket, they just basically chose to excuse themselves from that and participated with the insurance company. I want to look at some unique features in here. There's mental illness that's serviced in here, rehabilitation, outpatient benefits, and this is really cool right here. We realize that there are some surgeries that happens with general anesthesia and some without general anesthesia. And as you can see here, there are significant daily dollar amounts for surgeries that are performed with or without general anesthesia, as well as with general anesthesia. Here's a very unique feature about our Health Choice platform. There is no other fixed benefit plan to date that we know of in America, anywhere, where you will be able to receive not one, not just 2, but up to 3 times the amount of what Medicare fee schedule would be for a surgical service. I can't stress that enough. If you went in for a gallbladder surgery and it was $5,000 that Medicare was going to pay for that surgery, and you are on a silver plan, that is a $10,000 benefit that that client is eligible for if you are on a silver plan. If you're on a gold option plan, that is a $15,000 benefit that that client would be eligible for, even though Medicare only agreed to pay $5,000 for that service. You will not find this anywhere in America. The same principle of 1, 2, or 3 times the daily benefit rate is also included on inpatient pathology and radiologist treatments. So if a client goes in for these services, they are also eligible for the same dollar benefit, up to 3 times the amount. That's pretty strong. And you're going to be hard-pressed to find that anywhere else in America. I want you to take another look at another unique feature here. We understand that many times when you're in the hospital, sometimes you end up seeing more than one surgeon. Your primary surgeon came and saw you, and he or she looked at your chart. But then here comes a second surgeon that picked up your chart. There's a fee for that. We accommodated that in here where there's a 20% benefit that's available for a secondary surgeon. The assistant surgeon gets paid also. We also extended that right over into the anesthesiologist. We know that they may pick up the chart. So if they picked up your chart, there's another 25% benefit that's included in there for the anesthesiologist as well. Let's take a quick gander at some of the additional outpatient benefits as we look into this. As you notice here, you will see that there is a $2,000, $4,000, or $6,000 benefit annually for additional outpatient services that are also covered. Let's start with the 20 doctor visits that you get. And this is eligible for in a physician's office or in an outpatient clinic. You are eligible for 20 of those benefits per year. 6 of those benefits can be used for chiropractic during that same calendar year. Now, I don't know about you, but I go to the chiropractor, and it was very helpful to know that I have anywhere from $60, $80, or $100 worth of benefit eligible to me to pay towards my doctor. So let's talk about that. If your doctor's visit is $125, and you're on a silver plan, and you have an $80 benefit coming to you already, that's pretty good. However, every single service within our multi-plan PPO network is eligible for repricing. Every service is eligible for repricing. So if that doctor's visit was repriced from $125 to $100, and I got $80 benefit coming to me because I'm on a silver plan, then my exposure is $20. If I was on a gold plan, my exposure is $0. If that doctor's visit at the 125 was repriced down to $60 and I'm on a silver plan, guess what just happened? Now I'm up $20 for lunch. And I'm up I'm up $40 if I was on a gold plan. So this is really, really unique, guys. To find this anywhere else in America, you're going to be hard-pressed to find it. Same principle applies for the MRIs and things of this nature. All of that is subject to repricing. Now, there are emergency room and ambulance benefits that's included in here. And there's not a very generous dollar amount right here, between $500 to $1,500 for ground or air, but that is complemented in the rest of our plan as you would go further when you see the accident side of our platform, which allows them to go up to $10,000 worth of benefit for ground and air ambulance. That's pretty significant. We'll get to that a little bit later. Let's take a look at some of our preventative care benefits. I don't know about you, but nowhere else in America that we know of to date, in any fixed benefit platform, will you find an accommodation that is made for colonoscopies and for mammogram services. That's included and applicable 60 days after the policy has been in effect. 1 per calendar year for each member within the household. So in a family of 4, there are 4 of these benefits that are available for 1 for each and every one of them. The question then comes to mind is that if we have a minimum essential coverage platform in here that already covers all of our annual physicals and things of this nature, why would we need it built inside of the plan as well? Here's the reason why. We all understand that your physical at the beginning of the year in January, things can happen to you throughout the year. And if something happens to you throughout the year and you need to get a second opinion, that money has to come from somewhere. So we've accommodated that and built into the Health Choice Select platform already these benefits available where there's a dollar amounts eligible for that individual to be able to use as needed for second opinions or for backup services that needs to be handled in this arena. We understand that cancer is a big thing. And as a result of that, we wanted to accommodate these particular services by making these benefits available for our clients. Let's take a look at our critical illness platform. Our critical illness is quite unique because a person can purchase in blocks of 10 up to $50,000 worth of lump sum benefit. I want you to understand what I'm talking about here. That $50,000 worth of lump sum benefit, we know it doesn't solve the problem. But believe me, when you've just had a heart attack and you're laid up in the hospital for a few days, 10 days, it's nice to know that from our fixed benefit side, you're receiving ICU money. And if you're on a silver plan or a gold plan, you're getting anywhere from $4,500 to $6,000 a day. That's beautiful to know that. But it also helps to know that a lump sum benefit of up to $50,000 can be given to you so that you can take care of the things that you need to take care of in the house. The bills are still being paid. You can get second opinions. You can take some time to think and sort things out with your family while you're going through this time of crisis. It's very important. And what we've done with this is not only make it eligible for the parents, but $10,000 is also available per child in the house, doesn't matter how many children they are. That's also included. And this plan can potentially pay on two legs of benefit. What do I mean by that? If an individual, God forbid, came down with cancer and they had a $30,000 benefit and they got a lump sum payment based on diagnosis only for that $30,000, and say within the next 30 or 60 days, God forbid, they're so stressed over that news of the cancer they caught a heart attack, this plan could potentially pay them an additional $30,000. So we're looking at a potential $60,000 benefit for that client for that critical illness issue. That's pretty strong to know that that peace of mind is available for your clients. Let's take a look at our accident policy. Now, you guys have looked at accident policies, I'm sure, all along, and there's several accident policies out there which are a lot more benefit rich on the front end than ours is. This is not an apology. This was done by design. I want you to understand what we did here. Our accident policy pays a benefit of $4,000 per incident for a covered person. But it comes with $100,000 worth of accidental death benefit included. That's pretty strong. Most others stop at between 25 and 50. We went all the way to 100 on that. But here is where it gets even better. You've got an additional $10,000 worth of ground and air ambulance of money sitting there to work in conjunction with what you had in the Health Choice Select platform in the hospitalization side. That additional $5,500 to $1,500 mated with this additional $10,000. On top of that, there's a $300 a day daily benefit of income that pays in addition to what you are being paid for your hospitalization if you were in the hospital. So let's say you're on a silver plan and you went in because of an injury and you're getting $6,000 a day and you've been in the hospital 30 days. God forbid you were in there that long. But if you were in there that long, you would receive from the accident side of your platform an additional $300 a day in daily benefit coming to you. But that's not the main enchilada about this whole thing. Here is where it gets very unique with our accident platform. Most accident plans are worried about what happens to you on the front end of the accident, and that's good. But we were very concerned about what happens to an individual on the back end of an accident because now they cannot work as a result of that accident. We accommodated that with an optional disability rider income benefit that is included in our accident plan. It's attached to an accident, so if you can't work for 30 days after an accident, you can receive up to $2,000 worth of benefit or equivalent to 60% of your income, not to exceed the $2,000. This policy can be issued to someone up to age 75 and renewable up to age 80. That's very strong. Let's take a quick look at our dental plan. The unique thing about our dental plan is that it sits on the Carrington network, which is a nationwide network, is very strong, but that's not the unique feature. The unique feature about this is that because it sits on the Carrington network, if you happen to be visiting the grandkids and you're somewhere where there is no network provider and you happen to have a dental problem, you cracked a tooth or something of that nature, you can feel free with confidence to go to any non-network provider, and that non-network provider will be paid this regular fee schedule based off of the Carrington network schedule for that service as if they were an in-network provider. Any overage would be the responsibility of the client. But the substratum, the bulk of that bill, based off of what that procedure was, would have been covered as if they were a network provider. That is the AHO difference. Let's talk about the Health Choice Select Fixed Benefit, and let's dive in a little bit more in terms of what happens with the first day confinement. That can be a little confusing for some people. I want to talk about that. The client has the option of choosing 20, 50, 80, or 100% first day participation or co-oping with the health insurance company. This allows the client for first day confinement, whether it's intensive care or just basic sickness, one reduction per calendar year per covered person for the benefit. So again, if you are on a silver plan and you were going to receive $3,000 worth of benefit for the year, for the day, instead of taking the $3,000 day one only, you would have received $1,500 worth of benefit. And day two onward, you would receive the full $3,000 worth of benefit. Why would you do this? You would do this in lieu of you writing a check out of your pocket. You allowed the insurance company to partner with you, and they covered the deductible for you. That's basically all this is. It's a true no money down experience for the client. Outpatient and ambulatory surgical benefits. We talked about this. Surgeries performed under general anesthesia and surgeries performed not requiring general anesthesia. That is available on our Health Choice Select insurance products. Surgical benefits. Let's look at that. The reimbursement schedule based off of Medicare, what Medicare resource-based relative value scale would be for your particular state. Because you may be in Michigan and that's one cost, you may be in Florida, that's another cost. So based off of what Medicare will pay for your particular state, the provider is going to be paid up to 3 times the daily benefit amount. So if it's a $5,000 procedure and you're on a silver plan, it's a $10,000 benefit. If you're on a gold plan, it's a $15,000 benefit. And that is covered under pathologists and radiologists as well as any other surgical benefit. Now, outpatient benefits, there's no calendar year outpatient schedule deductible. None. Okay? There is none. You get 6 chiropractor visits out of those 20 doctor visits that are available for you per year. And the applicants only need to verify one set of questions on an e-verification or a telephone interview in order to qualify for this program. Let's look at how a first day reduction of benefit actually applies. Okay? Here's how it works, guys. So let's take an example here of 3 days in the hospital based off of an injury, $6,000 a day, and they're on a gold option 3-unit plan. Now, for 3 days, they would have received $18,000 worth of benefit. However, they had a surgery that was done inside here, and we accommodated for that. So there was an additional $4,900 worth of benefit available. Now, they had anesthesia. Anesthesiologist came and picked up the chart. Because they picked up the chart, there's a 25% benefit that was available in there towards anesthesia, so that accounted for another $1,200. The total eligible benefit for this client was $24,000 in monies. However, if they were on a deductible plan, that client would have had to write a check for either $2,500 or for $5,000 worth of benefit, and in some cases $10,000 worth of benefit. In this case, the client never wrote a check because they participated and partnered with the insurance company. This was done on a 20% reduction. The client now, we minused out of day one $6,000. We took out the $4,800. The client's total eligible monies for benefit would have been $19,000 to cover these procedures for those 3 days, and this is subject to repricing. So huge discounts would have been eligible to that client for in-network service providers. Let's take a look at some of the examples of the premium cost. And here again, we're going to use a $250,000 face with a 20% first day confinement participation. And we're going to use, on our silver plan, no deductible. Look what happens to a 40-year-old. $142 for the Health Choice Select plan by itself. This does not include the critical illness or the accident or with the disability or the dental or anything else. But for a 40-year-old can literally get a health insurance plan for $142. I don't know where you're going to find it in America. Based off of major medical, you'll be paying twice as much. 40-year-old female, $157. Look at a family of 4 here. 40-year-old, 2 children, $448. A 45-year-old is at $500. This is changing the landscape of healthcare in America. One client at a time. What's the difference between a major medical versus a hospital indemnity fixed benefit plan? Let's take a look at that. On a major medical side, expenses are incurred, and those expenses, they're paid based off of the expenses that are incurred. Deductibles and co-payment is applied against those eligible expenses. On our side of the track, it's not covered that way. Deductibles is applied against the daily benefits. Thus, the example of the reduction of first day confinement benefit as opposed to someone writing a check. But there's a little caveat that I want you to understand here. With major medical plans, a client may potentially pay 4 times before any service is rendered to them. The clients faithfully pay their monthly premium, just like they do with us. The client would pay a deductible, unlike they do with us. The client will pay a co-insurance, unlike they do with us. The client will have a maximum out-of-pocket expense. We don't have one. So the fixed benefits are first dollar coverage products based on cash reimbursements or client assignment of benefits. That's the difference between the major medical versus our plans. Let's look at some comparisons as to exactly how things stack up out there. And what I want you to see here is that we have America's Health Options with our Health Choice Select platform here against some of our Christian sharing ministries such as Alera, such against our short-term medicals such as NatGen, and against other fixed benefit plans such as United Healthcare's Protector Guard. All right, let's take a quick gander here, guys. Right off the cuff, you can see we have 0 deductible. So does NatGen. So does United Healthcare. But here you can see, in this case, Alera, which is one of the top Christian networks out there, and we got nothing against them. I want you to understand that. There is nothing against any of these other services. What we're doing here is making a face-to-face comparison as to how we stack up against the competition. Anybody that's out there offering services to help the public against the Obamacare or the Trump care or Pence care, whatever you want to call it these days, we're all for it. Okay, we're on the same side, we're shooting in the same direction, but there are unique differences between them versus us. So here you can see we have no deductible. The next thing I want you to notice here is that we have a $5 million lifetime maximum versus $1 million from Alera, $1 million from United Healthcare, and NatGen claims to be unlimited. I'm not quite sure if it's unlimited or limited, but that's left to be seen. If you notice here, also we have hospitalization sickness. We pay from $1,500 to $4,500 a day. If it's an injury-related matter, we pay $3,000 to $6,000 per day versus NatGen paying anywhere from $1,000 to $3,000 a day for 31 to 90 days maximum. We will continue to pay our benefit until one has exhausted that $100,000, $250,000, or that $1 million face. Unlike NatGen, unlike United Healthcare, which only pays for 180 days, and they pay a maximum of $2,000 worth of benefit. Mental illness, alcohol, and substance abuse. We cover that. We make an accommodation for it. None of the others covers that. We understand people make mistakes and they need help. We want to accommodate every need of every client as much as we're able. If you notice here, additional things within our coverage. We have our accident options included in our platform. It's not available on Alera. It's not available on NatGen, and it's not available on United Healthcare. If you notice here also, there is a waiting period. Okay, now, for inpatient surgery, we pay up to 3 times the dollar amount. We talked about that earlier. That's significant based off of Medicare fee schedules. With Alera, there's a 6-month waiting period before they would even look at it. And there is no guarantee because they're not true insurance. They're not regulated by the insurance commission. So if a client has a problem, there is no recourse. And there's no guarantee that the bills have to be paid because they're not structured on a true insurance platform like Health Choice Select is, like NatGen is, or like United Healthcare is. So that's a big problem. I don't know about you, but if I'm sitting with the client and an advisor, if I'm the client and an advisor is looking at me and saying to me, look, I have an alternative to what the ACA is going to offer out there. I have an alternative, but I got to tell you up front, it is not true insurance. There's no guarantee that the bill's going to get paid, but we can cover you. I'd be really hard-pressed to think about taking that policy. I'd really be hard-pressed about that, okay? So there's a 6-month waiting period with Alera. There is a $1,000 up to $3,000 maximum daily benefit here with NatGen, and a $2,000 maximum benefit only twice per year with United Healthcare. But with us, we will pay 3 times the benefit of what Medicare fee schedule says it would be, and we'll continue to pay that for each time that they have a surgical procedure that's different. We will do it. That's very unique. You won't find that anyplace else. What else is in here that's chock full of benefits? Our accident policy, again, $2,000 to $4,000 worth of optional benefit. There's none available on Alera, and the Trio Med option is available with NatGen, and with United Healthcare, it is a completely separate issue altogether. Let's look at a little bit deeper at some of the other comparisons. Right off the cuff, we offer up to $50,000 of that unique critical illness benefit for catastrophic. That's important. It's not available on Alera Healthcare. NatGen uses TriMed, and it's a separate policy for United Healthcare Protector Guard. Okay. We also offer in here our emergency room benefit ranges from $100 to $400. It's only $75 available with Alera, and only $100 available on NatGen or United Healthcare. Also included in here, we have physical, occupational, and speech therapy services which are available. That is a problem. It can happen. You may have children that may need speech therapy. You may have had an injury and you need speech therapy and occupational therapy. No one accommodates for that. We accommodate up to $2,250 of daily benefit, for that particular service. It is not covered by Alera, not covered by NatGen, and it's only $25 daily benefit, only paid one time for United Healthcare. I think there's some unique differences here between us and them. If you notice here also, generic or prescription drugs. Well, we have a full formulary prescription drug plan. True formulary plan. It is not available with Alera because they offer a discount card or a copay card. They get a discount card on NatGen. With United Healthcare, they get a $10 to $25 per day benefit twice a year. We offer a true formulary plan. All of us use the nationwide PPO network except for United Healthcare because they have their own network. But pre-existing conditions, I want you to pay attention to this, guys. We have a 12-month hold on pre-existing conditions. Alera is 24 months. That's a pretty long time to go for anything that may be pre-existing, that may be new occurring on that pre-existing. They won't even touch it for 24 months. At least with us and with NatGen and with United Healthcare, after the 12 months, if you have a new occurrence that's occurring with that pre-existing issue, we will attend to it. Minimum essential coverages, it's included in our platform with those 63 benefits for men and 67 wellness services for women. It's available 9 months after waiting period on the Alera product. It is available as an option. Excuse me. Also on the NatGen or on the United Healthcare option. However, our dental plan and visionary plan included offers anywhere from $1,500 to $2,000 optional benefit, and that's per family member. That's not for the whole family. It's not included on the Alera Health Plan. It's a separate policy on the NatGen plan as also on the United Healthcare plan. But here's what really sets our rainbow of benefits apart. Take a look at this. We have an optional term life rider that's included. Our term product will allow you to have an additional catastrophic option where it's available in the states that it is. Now, this is unique. You got to understand this, guys. We understand that right off the cuff, $50,000 is not enough benefit for a catastrophic situation. But if your client has our full financial health plan suite, which includes our life product, what does this do for the client? 50% of whatever the face amount is for that life product becomes an automatic catastrophic supplement to complement the $50,000 worth of critical illness that you gave that client. How does that mean in dollars? If a client came down with cancer and they got $50,000 benefit immediately lump sum from a critical illness side in the health plan, and they had an $80,000 policy with our life plan, $40,000 worth of that becomes a catastrophic supplement to go along with that $50,000. Now they have a $90,000 benefit, but it gets even better. If that client was deemed terminal as a result of that critical illness, we can now advance them an additional $65,000 worth of benefit from that $80,000 policy as a terminal illness with no additional cost to the client. That client was just paid $105,000 from an $80,000 life policy for a catastrophic supplement to complement the $50,000 that you took care of for them on the health side. That client now just received $155,000 worth of catastrophic benefit. Now, if that's not strong, I don't know what is. And what happens to the other $15,000 that was left inside of that $80,000 policy if all those systems were activated? That money, if the family leaves it alone to that agent, to that client's 65th birthday, it now compounds at market rate And whatever that dollar amount is at that client's 65th birthday, even if they're not here, would become a legacy fund for that client's family. That's pretty strong. That's the AHO difference. Nobody has this rainbow of benefits anywhere in America today. How do you write this plan? Here's how you write it. What you're looking at right now is a one-page fact-finding sheet that allows you to build your plan for your client. First thing you want to do is collect the information. The client's date of birth and family information goes there. If they have any pre-existing conditions, you want to also put it on the pre-existing condition line. If this is a two-sales process because you're going to see the client a second time, you would set your appointment dates right there. Next thing you want to do is you want to find out what the client currently has. You want to list their current insurance plan, whether it's Blue Cross, Silver plan, you put that there and what they're paying for their current monthly premium. However, when you put the current monthly premium, you want to ask the client a specific question. Mr. Client, now that we've established the fact that you're on the Blue Cross plan and your deductible is X number of dollars and your total family deductible is X number of dollars and you're paying, $1,900 a month in premium. If I were a Blue Cross agent right now, Mr. Client, and I had the authority to change your payments to something that's more palatable for you and your family, what number would you want that to be? He's going to give you his budget. So if he says to you that, look, I'm paying almost $2,000 right now, I'd really like to be down about $1,000. You said to him, Mr. Client, $1,000 discount is not impossible, but it may not be plausible in this particular case because of your ages. However, if I can shave off an additional $200, $300, $400, $500 off of your plan to give you that savings starting the next month, would you be willing to take this plan today? His answer is going to be yes, absolutely. The next thing you've captured that budget number, you want to go ahead now and you want to ask him some particular things. By the way, Mr. Client, does your existing plan have prescription drugs in it? Well, it may or may not. Does it have a fixed benefit option plan in there that pays you cash while you're confined in a hospital? Well, we know it doesn't have that. Does it currently have an accident plan built into it with a disability component that pays you, God forbid, should you can't work as a result of tripping over the family pet? Well, it may or may not have that, but it doesn't have the deductible, the disability option. And you want to ask him, does your plan have a dental plan included into it? It may or may not. Does your plan have a critical illness option that gives you a lump sum benefit right off the cuff for second opinions and time for you to be able to readjust yourself with your family? The answer is no. No major medical plan has those. Why would you ask these questions? You're asking for two reasons. One, you want to disturb him as to what was he paying $1,900 for? And number two, you want to familiarize him with these terminologies because your plan has that included. So the next thing you do once you've done that, you build his plan. You add the MEC for the minimum essential coverage, whatever that may be, whether it's an individual member or whether it's a family, the dollar amounts are there, and you place them in the necessary columns. The next thing you want to add, you want to pick your health plan. You want to pick the Health Choice Select, and you want to check the box whether he's taking 20%, 50%, 80%, or 100% participation. You check that. The next thing you want to check is he taking any accident with disability, where he's taking prescription drugs, he's taking critical illness or dental. You include those in there. You build the plan. Once you've built those plans, the next thing you want to do, you want to take his proposed new premium, put it in that slot, subtract it from his existing premium, and that gives you his total monthly savings per month. He immediately sees his savings for the next month on one sheet of paper. Everything is itemized in this next section right here, so he can follow the cost line by line of what each component of his plan is going to cost him. He has that built in, and you simply ask him, what day do you want your account to be drafted? First or the 15th? It's just that simple, guys. Really, it's just that simple. Let's take a look at what happens now when we compare commissions for major medical versus Health Choice Select at America's Health Options. Look at what we're looking at here. Here's a Blue Cross plan. It's a 48-year-old male, a 49-year-old female, and 2 children. And they're looking at a family deductible of $13,000. They're looking at a out-of-pocket maximum of $14,000, and they're looking at a monthly premium of $1,950, and they're making a whopping $125 here from Blue Cross, or $15 annualized out. It's going to come out to about $720 is what they're going to get here. Let's take a look at the same situation with our plan. Here we go. Now, let's add these commissions up. Let's take our Health Choice Select. We gave them $1 million benefit per person. So in this case, there's $4 million inside that house. Cost is $665. You're getting paid 20%. You're looking at a $1,596 commission. But we add the minimum essential coverage, another $165, $4 for that, $48 annualized. Critical illness, $30,000 on each parent, $10,000 each kid, $135, 65%, looking at another $1,000. Accident and disability with 12 months worth of disability, $133, 45% in commissions, another $723 there. Dental, $60 for the cost of the whole family, 35% commission, and we're looking at another $254. Life insurance, we went in there with our return of premium feature, $100 payment for the client, 60% commissions, $720 worth of additional monies. This is the beauty of the stacked option situation here with America's Health Options. This is why we sell it stacked, guys. Here is why. Look at the total for the client, $1,260 versus $1,950 over here. But look at the commissions. Your total accumulated commission for this annualized situation is $43.98. That is a significant difference. I don't know about you. If you want to take $720, you're free to do that. But if you want to really make an impact in helping your client as well as helping your family, I think you need to be selling more products. Now, let's talk about what happens. How do you resolve your income situation by taking our health options? Look at this. If you sold 4 major medical plans at a $1,200 a month in premium, $4,800 with an average commission rate of $15, with the average agent commission at $120, but they're only going to keep it for about 6 months. Why? Because the premiums are just too high. You're looking at $720 annualized. But what happens if you decide to sell 4 of our Health Choice Select plans? Okay, just the Health Choice Select, the hospitalization only, at $665. It's a $2,600 situation for that month. But at 20% is $532. But they're going to keep it for 12 months. Why? Because it is a lot less expensive. That's a $6,300 situation there for just the Health Choice Select alone. But when you include the stacked suite option and you added the critical illness right here for another $4,200, and you added the accident for another $2,800, and you added the dental for another $1,000, and you added, and this is all multiplied times 4, okay? And you added the life product here, again, 4 of those policies, and you added the 4 MECs coming in here. What are you looking at here? Plus the fixed benefit, that's a $17,000 annual comp. I don't know about you, but that's a significant difference for 4 policies. You're looking north. If you do this every month with just those 4, you're in a 6-figure income. What if you did this and did it at $12 a month? Now you're north of $200,000 in income. That's pretty strong. We've just solved your income problems right off the cuff. Now, let's talk about some of our summer bonuses. At America's Health Options in Philadelphia American, we're always doing bonuses. Now, a lot of you guys may have missed the last winter bonus that we had. Those checks are going to be going out rather shortly to anyone who was eligible for those bonuses. But we got another bonus that started on March 1st, and we're going to run this right through to July 2nd. Okay, going to run it through July 2nd. And it's really easy to qualify, guys. I mean, come on, let's look at this. $75,000 worth of premium. I mean, if you can't write that, you got a problem. I just showed you where 4 policies a month gives you $17,000 worth right off the cuff of commissions, which, I mean, you will meet that very quickly. You can meet this within 90 days if you just stuck to it and wrote 12 a month. You know, that you could easily meet it. And that's a $1,000 bonus check coming to you right there. Okay. At 65,000 to 7,400, it's another $750. 50,000 to 64,000 is $500. And 35 to 49, looking at $250 in just monies. This is bonus money on top of your commission. There's no reason why you not want to participate in. What policies qualify for this? The dental policy qualifies for this. The critical illness policy qualifies for this. If you sold our unique gap plan, which is quite unique. We never talked about the gap plan, but something that you really need to look at, guys. For those of you who write major medical and want to gap somebody's deductible, our gap plan pays 100% of inpatient services and 50% of outpatient services. There is no other gap plan on the plan like that right now that does that particular thing. So we can talk about it in another session. But the Health Saver 3 and the Health Choice Select is what qualifies you for this particular bonus platform. You guys need to get out there and start selling it. Here's a picture of our management team. And as you can see here, each and every member, Jerry Bowles, you already know he's on this program with me right now, and for AHO Radio section. And Jerry, I'm going to turn this back over to you.
Mr. Fowler, all I can say is, wow, sir. Guys, this was Mr. Clive Fowler, the CEO and managing partner of America's Health Options. As I promised, and I think you would agree, this was some very valuable information. Clive, thank you again for this awesome training. Again, this training platform was brought to you by AHO Radio, and it's the agent service and training platform for America's Health Options and insurance plans. So stay tuned for future airings. Until then, great selling. God bless you. The wrap.